Okay, now coming to the history of pathology. The one thing which you have to keep in your mind is that the pathology history or any medical science history is started, if you're talking about the written evidence, then it is started in the 17th century. Okay, 17th century. Here we have the certain written medical history. Okay, written medical history which shows about the evidences of the disease. Fine, but on this very moment, on this very time period, the one thing is the people, they believe that the disease is caused by the spirit invasion. Okay, spirit invasion means there is a something called demon. Okay, and there is a something which is called as the deity. Okay, so demon deity theories are popular on that time. Means this is the disease is not caused by the microorganisms. You know that microorganism is the smallest organism which you cannot observe by your naked eye. Okay, so microorganism discovery is hidden until there will be a discovery of certain, you can say, the microscope. Okay, which emerge the microscopic world. So previously people will believe that disease is, you can say, caused due to the spirit invasion or something called as the superstitious power. Fine, or also called as the divine mercy. Okay, if on that very moment, if some people are suffering with the certain diseases, then people believe that they will did the mistake. That's why they develop this kind of disease. Okay, so this is called as the deity-driven theory. Okay. Then you know that the everything is dynamic, nothing is static. Okay, so everything is dynamic. So discoveries move forward, move ahead, and then there was a team of Greek medical community. Okay, Greek medical community, and in this community there were many scientists. One of the notable example is your Hippocrates and Alexander the Great. Alexander the Great with the Aristotle. Okay, so these three scientists, they have the one thing is one clear vision in their mind that the disease is not caused by the demon, or it is a spirit invasion. It is caused by something else. Fine, but in this time period there were no any, you can say, the microscope discovery. Okay, and any other alternative, you can say, the diagnostic tools which find out about the disease, that was not there. Okay, so they thought that the disease is caused by the disease is related with the natural cause. Okay, this is related with the natural cause like earthquake. Okay, earthquake, you can say the nuclear explosion. Fine, and many more. Okay, then the scientists move ahead, and there were you can say one landmark discovery. Okay, which amazed the era. Okay, which amazed the era, and that is the Harvey's experiment. Okay, that is a Harvey experiment. Harvey's demonstrate in their lab Harvey's experiment, and this is a very famous experiment. Okay, he demonstrated that human possesses a heart. Okay, and human have the circulatory system. Okay, they have the arteries, they have the veins. Okay, they have the capillaries. Fine, they demonstrated in their experiment, and their experiment, through their experiment, the cardiovascular system is discovered. So that can be asked in the MCQ, that who discovered the cardiovascular system, or also called as who discovered the heart. It is a Harvey. Fine, then when this cardiovascular system is discovered, fine, then scientists were curious, that they thought that if there are something which is beyond the human eyes resolution, okay, then we have to develop certain apparatus, certain, you can say, the equipment which can detect those fine things. Okay, so for that there was three, you can say there are many more, but one of the notable example is the Robert Hooke, okay, and Antony von Leeuwenhoek. Okay, he discovered one compound microscope, okay, a blunt kind of microscope, and by which he see the dead cork, okay, dead cork. Then there was another scientist that is called as the Antony von Leeuwenhoek. He first time seen the live cell, that is a human spermatozoa, also called as the human sperm. Fine. And now this discovery, it changed everything. Okay, it changed all these theory. Okay, and then when this microscopic world is started, fine, then scientists are able to not only prove that the disease is caused by the microorganism or the other, you can say the trauma or other causes, they are also arrived at a point where they can manage the disease. So the first vaccine which is discovered for curing the pox, a smallpox, that is done through the Edward Journal. So Edward Journal discovered the first vaccine, and this vaccine is for management of smallpox. Smallpox. Got it? No problem. Then discoveries start further moving on. Then there was discovery in the organic chemistry. Okay, and through the organic chemistry, some of the chemists, they discovered certain dyes. Okay, dyes are something, you know, that your cell, if you put your cell in the microscope, you see nothing. Okay, you see nothing. You have to stain the cell, means you have to impart the color over the cell. Okay, and that is done through the dyes. Okay, so chemists discovered the dyes, and one of the notable dyes is your eosine, hemotexine. This is currently also used for staining of the nucleic acid. Okay, hemotexine. Apart from that, red cargo. So these are the dyes. Okay, these dyes doing what? They stain the specific part of a cell. You know that cell is having the cytoplasm, okay, the internal organelles, that is called as the mitochondria, ribosome, okay, the nucleus, and also they have the periphery, the plasma membrane. Okay, so everything take one kind of specific stain, specific color, and when you see on the microscope, it will you are able to understand their microanatomy. Okay, what? Microanatomy. Okay, now once these cell organelles they are discovered, then there is again further studies, and that studies is rely on the understanding the genetics. Okay, the human genetics. Then the human genetics, there were many scientists, okay, who are working to find out what is the exact genetic material in the human. Okay, then there are the two scientists who discovered it, okay, and they proved that the DNA is a genetic material in the living organism, and that is called the Crick and Watson. When we discuss about the genetics, we have the detailed lecture over genetics in our upcoming lecture. Then we will discuss about that. The DNA and RNA these two scientists, Crick and Watson, they given the double helix model, okay, which you can say the express their, you can say the structure, chemical structure of DNA and RNA. Then once scientists are able to understand the DNA and RNA, then they are also able to understand if you insert your DNA, okay, if you you can say disrupt the function of a DNA, that will result into the genetic problem, okay, the genetic disorders. Okay, then the modern era came where we are right now. Then there is a in the 1987 or 1998, there were discovery of certain imaging techniques. Okay, imaging techniques like your computed tomography, positron emission tomography. These are certain imaging techniques. Okay, you have your body is scanned, your particular tissue is scanned, and that is displayed. Okay, that is in your hand. Now you can see your internal structure in your hand. That is a fantastic discovery, and that is the CT scan, that is the computed tomography and positron emission tomography. Now, currently, where is pathology? Nowadays, pathology is dealing with understanding the personalized medicine. Means they have the one principle in their mind that this DNA and RNA is not static in every individual. At a minute level, they vary in every person. Means every person have the different kind of chemistry. Means every person will not respond with the same kind of medicine. Okay, so nowadays the medicine is designed in such a way that a specific medicine will work upon the specific kind of specific genetic people. Okay, got it? That is called as the individualized medicine, also called as the personalized medicine. So this is the history of pathology. This is the history of pathology, and the future discovery. Of course, the future discovery will more emphasize on understanding certain, you can say, the idiopathic diseases, also called as the autoimmune diseases. Okay, so the pathologists are still working in their lab to understand about the certain idiopathic diseases, the diseases where the causative agent is not known. Okay, and also those diseases where there is no any permanent cure, like for example the HIV. Okay, certain, you can say, the certain diseases like, for example, Alzheimer's is a neurodegenerative disorder, then Parkinson's disease. These are the motor abnormalities or central nervous system problem. Okay, so these are the diseases where the currently research is going on. So this is about the history of the pathology. Now let's move ahead and discuss about the branches of pathology.